ministerial broadcast, which will be followed by statements from the First and Deputy First Ministers.
Boris Johnson.
Good evening. The struggle against COVID is the single biggest crisis the world has faced in my lifetime. In less than a year, this disease has killed almost 1 million people and caused havoc to economies everywhere. Here in the UK, we mourn every person we have lost and we grieve with their families. And yet I'm more certain than ever that this is a struggle that humanity will win, and we in this country will win. And to achieve what we must, I want to talk to you directly tonight about the choices that we face, none of them easy, and why we must take action now. I know that we can succeed because we have succeeded before. When the sickness took hold in this country in March, we pulled together in a spirit of national sacrifice and community. We followed the guidance to the letter. We stayed at home, protected the NHS, and saved thousands of lives. And for months, with those disciplines of social distancing, we've kept that virus at bay. But we have to acknowledge that this is a great and freedom-loving country, and while the vast majority have complied with the rules, there have been too many breaches, too many opportunities for our invisible enemy to slip through undetected. The virus has started to spread again in an exponential way. Infections are up, hospital admissions are climbing. We can see what's happening in France and Spain. And we know, alas, that this virus is no less fatal than it was in the spring, and that the vast majority of our people are no less susceptible. And the iron laws of geometrical progression are shouting at us from the graphs that we risk many more deaths, many more families losing loved ones before their time. And I know that faced with that risk, the British people will want their government to continue to fight to protect them, you. And that's what we're doing night and day. And yet the single greatest weapon we bring to this fight is the common sense of the people themselves, the joint resolve of this country to work together to suppress COVID now. So today I set out a package of tougher measures in England. Early closing for pubs, bars, table service only, closing businesses that are not COVID secure, expanding the use of face coverings, new fines for those that fail to comply, once again asking office workers to work from home if they can, while enforcing the rule of 6 indoors and outdoors. A tougher package of national measures combined with the potential for tougher local restrictions for areas already in lockdown. I know that this approach, robust but proportionate, already carries the support of all the main parties in Parliament. After discussion with colleagues in the devolved administrations, I believe this broad approach is shared across the whole UK. And to those who say we don't need this stuff and we should leave people to take their own risks, I say these risks are not our own. The tragic reality of having COVID is that your mild cough can be someone else's death knell. And as for the suggestion that we should simply lock up the elderly and the vulnerable, with all the suffering that would entail, I must tell you that this is just not realistic. Because if you let the virus rip through the rest of the population, it would inevitably find its way through to the elderly as well, and in much greater numbers. That's why we need to suppress the virus now. And as for that minority who may continue to flout the rules, we will enforce those rules with tougher penalties and fines of up to £10,000. We will put more police out on the streets and use the army to backfill if necessary. And of course, I'm deeply spiritually reluctant to make any of these impositions or infringe anyone's freedom. But unless we take action, the risk is that we will have to go for tougher measures later when the deaths have already mounted and we have a huge caseload of infection, such as we had in the spring. If we let this virus get out of control now, it would mean that our NHS had no space, once again, to deal with cancer patients and millions of other non-COVID medical needs. And if we were forced into a new national lockdown, that would threaten not just jobs and livelihoods, but the loving human contact on which we all depend. It would mean renewed loneliness and confinement for the elderly and vulnerable, and ultimately it would threaten once again the education of our children. We must do all we can to avoid going down that road again. But if people don't follow the rules we've set out, then we must reserve the right to go further. We must take action now, because a stitch in time saves 9. And this way, we can keep people in work, we can keep our shops and our schools open, and we can keep our country moving forward while we work together to suppress the virus. That is our strategy. And if we can follow this package together, then I know we can succeed, because in so many ways, we're better prepared than before. We have the PPE, we have the beds, we have the Nightingales, we have new medicines pioneered in this country that can help save lives. And though our doctors and our medical advisors are rightly worried about the data now and the risks over winter, they are unanimous that things will be far better by the spring, when we have not only the hope of a vaccine, but one day soon, and I must stress that we're not there yet, of mass testing so efficient that people will be able to be tested in minutes so they can do more of the things they love. That's the hope. That's the dream. It's hard, but it's attainable, and we're working as hard as we can to get there. But until we do, we must rely on our willingness to look out for each other, to protect each other. Never in our history has our collective destiny and our collective health depended so completely on our individual behaviour. If we follow these simple rules together, we will get through this winter together. There are unquestionably difficult months to come, and the fight against COVID is by no means over. And I have no doubt, however, that there are great days ahead. But now is the time for us all to summon the discipline and the resolve and the spirit of togetherness that will carry us through.
Hello, you're watching special coverage of the Prime Minister's statement on the latest measures to combat the spread of coronavirus. We'll have analysis shortly, but let's go straight to Stormont, where the First and Deputy First Ministers are responding on behalf of the Northern Ireland Executive.
Good evening. We have just had a sobering assessment from the Prime Minister of the choices that we face as a nation. As we are all now very aware, this deadly virus has crept into communities in every county in Northern Ireland. Since Thursday, almost 700 new cases have been reported, and we are now reporting the highest number of cases that we have seen since the early stages of COVID. And there has been a rise in hospital admissions, with the number of hospital inpatients rising by 50% over this last week. We need to act. But I do want to reassure you that despite all of the headlines, this is not a second lockdown. This is a wake-up call, a reminder that we are not out of the woods. As an executive, we have agreed that your school, your shop, your factory, your business, your college, your local hotel or restaurant will remain open because they have all taken steps to stop the spread of the virus. The track and trace system also points to limited spread in those facilities. And as you enter those places, your hands will be sanitised, you will stay apart, and you may even wear PPE. We have, however, from 6 p.m. this evening, restricted how many people you can gather in your home. This is a tough restriction in a country where we are known for our hospitality. And despite all of our divisions in Northern Ireland, our doors have always been open. We are good neighbours. We are naturally hospitable to everyone, but it is no kindness to host or attend large gatherings in each other's homes at this moment. We speak specifically about the house parties inside and outside. The only winner in the long term from such scenes will be COVID-19. Over this last 24 hours, some of you have contacted us online. Now, this is not about stopping your elderly mum or dad coming over. They can be part of your bubble. They can still provide childcare, and you can still provide care to them. These are specific steps based on data and designed to protect your granny and grandfather. They're about protecting our elderly mothers and fathers. Our elderly friends and relatives remain the most susceptible to the virus and the most vulnerable. Now, I appreciate renewed measures are not good news, but they are proportionate and we are trying to be practical. As an executive, we will not get every last thing right, but our motives are to protect as many lives and indeed livelihoods as we can. And as I've said before, this is not a lockdown. In fact, these actions are designed to prevent the need for a return to lockdown. So if you are a tutor or a music teacher at home, your work can still continue. If you are a childcare provider, your work can still continue. If you're a tradesperson, you can still visit homes to provide your service. If you're a hairdresser or beautician working from your home or going to other homes, your work can still go on. But please be sensible when people come to your home or you visit their home for work purposes. Wash your hands, keep distanced, and wear a mask. All these small steps will help. The Executive will meet again on Thursday, and between now and then, we will look closely at the measures that have been outlined today in the Prime Minister's address. We will again consider our particular circumstances and work with the other UK regions, as well as with our neighbours in the Irish Republic. But be assured that every step we take will be appropriate and proportionate. We are resolute in dealing with this virus, but we cannot do this alone. And I'm asking every person to join with us to limit the virus. You know, I'm immensely proud of Northern Ireland. We are resilient and we are kind. And when our NHS staff needed encouragement, we all stepped up. 6 months on, let's give this one big push. For the sake of our brilliant NHS staff, our elderly and our vulnerable, let's just be careful in our homes. Keep washing your hands regularly and often, maintain social distancing and wear face coverings where this is not possible. Download the COVID-19 app, act promptly on advice about testing and follow the guidance on quarantining to the letter. Northern Ireland has been through a great deal down through the decades. We have risen to the challenge many times before. We did so to great effect earlier in the year, and we ask you to join with us as we endeavour to do so again. Together, we must drive down the virus so that Northern Ireland can get back to its best and the place that we all want it to be.
Good evening to all of you watching from home. And let me begin this evening by expressing my heartfelt sympathy to all those who have lost loved ones over this very difficult period. I want to acknowledge the loss and the hurt that you are feeling. Tonight we are taking this opportunity to speak directly to all in our community as leaders of the Executive to outline where things stand with the coronavirus pandemic. We find ourselves in a very serious position. Our Public Health Agency and the Department of Health have been monitoring the course of the pandemic around the clock, and they've been advising ministers on the most up-to-date evidence. We are deeply concerned by the alarming levels of spread of the virus across the community. In the days and weeks ahead, we expect to see the number of cases rise even further. We are in a critical period in our response to this pandemic, which continues to escalate globally. Our priority is about protecting people and it's about saving lives. That's paramount. We cannot afford to let our guard down, and we understand that you are tired of living your daily lives with restrictions, especially when it comes to getting together with family, friends and neighbours. As a mother and a daughter, I absolutely understand this reality. My family are also worried. We're asking for your continued patience so that we prevent more people from becoming severely ill. We take the pressure off our health service and all those that care for us. Tonight, we're sounding the alarm bells loud and clear throughout our society and asking you to go back to basics. Your health and the health of your loved ones is in your hands. Maintain social distancing, keep good hygiene, wash your hands often, work from home where you can, wear a face mask in public settings, in shops and in public transport, download the Stop COVID app. Please only share information which is from reliable sources. If you're displaying symptoms, book a test and self-isolate in line with the guidance. The choices you make could be the difference between life and death for those closest to you in the days and weeks ahead. Tonight, we stand here united as your political leaders. We're appealing for the whole community to play your part in uniting in solidarity to suppress further transmission of this deadly virus. We are now presented with a window of opportunity, and over the next 2 to 3 weeks, in which we can, by our actions, slow the virus down. Not to do so is to risk a worsening situation by mid-October. We want to absolutely avoid a complete lockdown in the coming weeks, and with you, we're trying to strike a balance of introducing limited restrictions whilst also living with the virus. We're supporting efforts to reopen our economy, keeping people in jobs, and most importantly, keeping our children at school. All of this must be done safely. Be assured, the public health authorities are monitoring the situation very closely. Your health and safety is our #1 priority. We live on an island and we need a coordinated all-island approach. Dublin knows that, we in Belfast know that, and London knows that. We need full cooperation on this island and between our islands in the fight back against COVID. This island is a single epidemiological unit and we must maximise that protection that affords us. We have come a long way in the last 7 months, and I know we've asked a lot of you. You have made great sacrifices, and we thank you for that. This is also a time when we need to have hope. Global efforts are well underway to develop a vaccine. As every day passes, we understand more about the virus. Treatments are advancing, and we look forward to the day, in the not-too-distant future, when we can all live without the threat of coronavirus. And until then, let us do everything that is within our power to stop the spread of COVID-19 throughout this island. Stay safe, save lives, Gur Maiogad Galer.
The First and Deputy First Minister speaking live at Stormont's Parliament buildings in response to the Prime Minister's latest COVID-19 address. With me to reflect on what we've just heard is our health correspondent Mary-Louise Connolly and our political correspondent Gareth Gordon. Welcome to both of you. Mary-Louise, we've had two separate, quite distinct messages there. Boris Johnson's relates specifically to England, of course. What Arlene Foster and Michelle O'Neill had to say is what's relevant to people here in Northern Ireland. Was there anything new in what we've just heard?
No, from what I could see and hear, this was just one last-ditch attempt to encourage the public to come on and to follow these restrictions. And what we've seen over the past 48 hours, Mark, is really a carefully, well choreographed approach from Downing Street, from that press conference yesterday, from the two senior medical and health advisors, outlining the scientific evidence. Then we heard from Boris Johnson yesterday, again tonight, and now from the First and Deputy First Minister. And it's really to try and convince the public one last time to get on board. They say that we can make a difference here in Northern Ireland anyway, that there is a window where we can, in the next 2 to 3 weeks, not time frame is important where we can possibly turn things around.
We may have fresh restrictions brought in after Thursday's executive meeting. We don't know about that for sure at this stage, but we have had new restrictions brought into effect here this evening, and maybe it's just worth reminding people what they are.
Well, most importantly, you cannot have visitors to your home. That's really, I think, the one that most people will grasp tonight and probably be most disappointed about. You can have 6 people can gather in your private garden, but from no more than 2 households. And also important, children aged under 12 from all the households, they cannot be counted in that total. So that is positive from what we've heard around the numbers.
The difficulty, of course, is, Mary-Louise, and you know this maybe better than the rest of us, there are so many hypothetical scenarios that members of the public are trying to think through, and it's very difficult to work through that sometimes. But what is the checklist that people need to be thinking about when they're trying to work out if they are staying on the right side of the regulations?
Mark, the problem with all of this is you cannot regulate, for every aspect of human life. And even when you attempt to, you will always find someone who will try and apply their larger than life-size way of life into a size 10 regulation. So there's always going to be blips in the system. But if you're trying to mitigate the risk when you're applying the various scenarios of where perhaps you want to travel to or where you want to go to, you have to ask yourself, is this an essential journey? And if it is, and you do need to go, can you wash your hands? Can you, if you're travelling in a car, wear a mask if it involves you picking someone up from the airport? Are there things that you can do and apply that will make the scenario a lot safer, not only for yourself and for the person that you're visiting, but for those that you're going to see afterwards?
Dr. Michael McBride, the Chief Medical Officer, said the other day what is critical is that people use their own common sense.
Dr. McBride did say that, and I'm sure that a lot of the officials would like to use that phrase on more occasions, just to say to people, listen folks, wise up or just use your common sense, because for a lot of these scenarios that's what it is, except where we're talking about the number of people who can go into a household. We know that you cannot invite people inside your house. You can have 6 in your garden, but only from 2 households. But you have to ask yourself, how many do we have enough enforcement to go around checking on people's doors? Very much so the public are being asked. They are trusting the public a great deal in order to abide by these regulations, to do the right thing. And I suppose sitting on your shoulder will be that angel saying, well, if you don't do this, we are going to face lockdown, and none of us want that again. And
Arlene Foster made that very clear. And she also made very clear during her comments there that it's house parties that are the major cause for concern.
Absolutely.
OK, let's bring in Gareth Gordon, our political correspondent, who's also been listening to what the First and Deputy First Ministers had to say. How significant is it that Arlene Foster and Michelle O'Neill opted to speak after the Prime Minister tonight, Gareth?
Well, I think what's happening here, and I agree with Mary-Louise, we heard absolutely nothing new at all. We could have written the speeches beforehand, but I think it's the way in which they were delivered in this presidential style, starting with Boris Johnson, followed by the First Minister and the Deputy First Minister. Essentially, what is happening here tonight, outside the normal news cycle, news bulletins, we're being conditioned, and we're being conditioned into being told that the next few months, indeed the next 6 months, Boris Johnson said earlier today, although there was no figure that I could see put on it by any of our First and Deputy First Ministers, we're being conditioned into being told that the next 6 months or the next few months are going to be tough, and you're really going to have to knuckle down. And they know that there will be people who will fight against this, that there's fatigue out there. It was mentioned by both of them in their speeches. But these people are being told, don't listen to any outside influences. This is what you must do. And I wonder sometimes if this is really about stopping Simon and Samantha from across the fence coming over for a drink. It is probably aimed more at these house parties. And the fact is, it's unpoliceable, some of this, but I think they're trying to condition people into doing the right thing.
Gareth, there has been clearly a real effort on the part of both the First and Deputy First Ministers to be seen to be getting the public health message out there today. They have been very visible in the past 24 hours compared to recent weeks.
It's a complete turnaround from what it was, obviously, a couple of weeks ago, don't forget, because of what happened at Bobby Story's funeral, these two ministers hadn't stood together at the lectern for 73 days. Well, they've certainly turned that around now. And basically, people don't want to see their politicians squabbling. They want a united message that this is not the time for politicians to be playing party politics. This is not the time for squabbles. They need a strong, united message. And certainly today, that is what they have got.
Gareth, mixed messaging, we all know very well, has been a major criticism directed at the executive in recent weeks. Do you think that lesson's been learned? Until
the next time it falls down, I guess. I mean, this stuff, you've got to look at it from the politician's point of view. This is not easy. Every time they come out with a statement, we look for questions, for chinks in that. What do we do? Can we travel to Banbridge to do some shopping or wherever it would be? So this is not easy. Has it been learned? I think they know it, but it doesn't mean it won't happen again.
Mary-Louise, how likely do you think it is that we will adopt some or all of the restrictions announced for England today? I mean, we've had 10 o'clock closing time for pubs and restaurants, wedding numbers reduced to 15. Is it only a matter of time before that also applies here?
I think that depends on what happens here over the next couple of weeks. We do seem to follow England, what they apply and what they do. We understand that on Thursday we are going to hear of more restrictions, and that will be around the hospitality industry. You know, will they go for that 10 o'clock curfew, 11 o'clock? Perhaps instead they have to keep in mind what's happening in the Republic of Ireland. Are we going to try and marry the two? Are we going to go our own way? We simply don't know. But I think it's likely that within the next couple of weeks, we will see this gradual step towards introducing other restrictions. That's what has happened over the past couple of weeks. I don't think that's going to change. If you look at what's happening in Dublin, pubs, restaurants have closed. A number can only operate as a takeaway. So while the focus so far here in Northern Ireland has been very much on households, I would expect that perhaps in the next couple of weeks that attention will turn to perhaps the hospitality industry, and we could see figures being limited in that scenario as well.
So what about the idea of a so-called circuit breaker, which would see a serious lockdown for a short, specified period of time?
The big question mark that I've been thinking about a lot today, if that happens in England and there is a reason for why it has to happen, I'm wondering, will it have to be applied across the other nations as well? Our figures in Northern Ireland, while we still have the highest rate per 100,000, but thankfully the hospital activity is still very, very low. So it would be interesting to see England applying that approach. Would it apply here? There is a lot of whispering going on around the Halloween break, Guy Fawkes in England, where Michelle O'Neill did say tonight, she mentioned the 2 to 3 week period. Will they see where we are in 3 weeks' time? And if our figures haven't improved, could we see that approach being applied all over the UK?
Gareth mentioned it a moment or two ago. It was mentioned in the speeches. If people organising house parties are the real target here, is there an argument, do you think, that the rest of us are being asked to put up with a lot of potentially unnecessary restrictions, frankly?
Well, I think if you asked a lot of the public, they would say yes. But if I am going to answer on behalf of the health officials and what the executive want to see happening, we looked at applying all of this to certain postcodes. Clearly, it didn't work. The message was muddied. And there was a sense of clarity, no clarity, there was a lot of confusion. So I think they had to realise if we do one approach, we have to apply it across Northern Ireland.
Just briefly, it's 6 months tomorrow since lockdown was announced. Boris Johnson talked about these restrictions being in place for the next 6 months potentially. So that's a year we'd be looking at.
That's right, Mark. That's a lot to get your head around this Tuesday night. But yes, 6 months ago, 23rd of March, it's an important date in my household. I remember it well. Lockdown was introduced. If we are looking ahead to another 6 months, as Boris Johnson has said, that means we are living with these restrictions for a year.
OK, Mary-Louise, thank you very much. That's it for now. There's further coverage on the BBC News NI website. Next television news is at 10:35 here on BBC One. I'll be back on Thursday with The View at the usual time. For now, from all of us, bye-bye.
The 2020 Irish Open.